California in the time of the coronavirus, a state hit so hard that bodies are being moved to temporary storage containers. Newly confirmed cases are rising at a dizzying rate despite lockdown restrictions. Now health experts are warning that a more contagious variant, first discovered in the UK, could fuel another wrenching surge of cases and deaths.
It could and likely will get worse in the next couple of weeks, or at least maintain this very terribly high level of infections and deaths that we're seeing.
Vaccinations are rolling out, albeit too slowly, but the US is nowhere close to reaching herd immunity.
COVID, COVID, COVID. That's all they talk about, the fake news. COVID, COVID, COVID.
President Donald Trump continually played down the pandemic, politicized the wearing of masks and blamed states for moving too slowly. Now with his presidency in its final days, it's Trump who's being blamed for failing to act and allow the virus to spread so fast. In May, the US recorded 100,000 deaths. By September, that figure doubled. Now it's doubled again, with the new administration promising to ramp up vaccinations to a level that has so far come nowhere near close to what was promised.
Look, our plan is as clear as it is bold. Get more people vaccinated for free. Create more places for them to get vaccinated. Mobilize more medical teams to get the shots in people's arms. Increase supply and get it out the door as soon as possible.
For many, 2021 was a year that would bring renewed hope. Instead, new cases threaten to cripple already overwhelmed hospitals, claim more lives and leave many wondering when this nation will turn the corner. According to the Journal of the American Medical Association, COVID-19 is now a leading cause of death in the US, outpacing both cancer and heart disease. One leading epidemiologist says the US will beat COVID, but only after it's been through hell. With vaccines on the horizon, the end may be in sight, but for many, it'll be too late. Andy Gallacher, Aljazeera, Miami, Florida.
Well, let's bring in Dennis Nash. He's the Executive Director of the City University of New York's Institute for Implementation Science in Population Health. He joins us via Skype from New York. Dennis, so 400,000 deaths across the US. It's the country, as you know, with the most number of infections and deaths. How would you sum up where the outgoing administration has failed in its handling of this pandemic?
Well, from a population health standpoint, this death toll is, of course, a direct result of our country's inability to adequately control community spread. But then, given that we also have high levels of community spread, unfortunately, in the U.S., that 400K death toll specifically has a lot to do with our inability to protect our elderly population in nursing homes, long-term care facility, and other congregate settings, as well as our essential workers during pandemics. I think in the U.S., at least, these settings are just not equipped to detect or squelch outbreaks during a pandemic, especially when there's no vaccine for the pathogen. So there's no credible plan to ensure, workplace safety. And the lack of any credible or effective response by the Trump administration, including one that protects these populations, is a huge part of why we have such a high death rate in the U.S. Today. And it absolutely didn't have to be this high.
Yeah, Dennis, and President-elect Joe Biden says his #1 priority is the pandemic. What are the main challenges facing the new Biden administration from a public health point of view?
Well, I think, there's a lot that we've seen has gone wrong in the past administration. I think one of the, they need to turn the tide on this current pandemic. And I fully expect to see, considered science-informed strategies for prevention and mitigation of spread and in the community and in workplaces, in addition to the vaccine plan. The vaccine plan is very important, but as we've heard, there's also ongoing community spread that is going to be even faster while the vaccine is rolling out. And so, supporting healthcare workers to provide the best available treatment to COVID patients and effective implementation strategies for rapid and I hope equitable rollout of all these available vaccines that are coming down the pipeline. Informative public health messaging, leadership by example, leveraging technology, and not privileging economic interests over the more fundamental priorities.
Yeah, and we're hearing that health officials in California are investigating a mutated strain of COVID-19, which may be different to others found around the world. Is this likely to make the rate of infection much worse, do you think?
It's certainly a theoretical and very concerning possibility. And, this is why I think, we need to really prioritize both prevention and mitigation of spread and speed up the vaccine rollout as soon as possible, yes.
All right, Dennis Nash, thanks very much indeed for your thoughts. Thank you for talking to Al Jazeera.
Thank you.